Hello, everybody. This is Dr. Kamel, and this is medical terminology number 7. If you didn't watch any of the videos before, please, there are 6 episodes in this topic, medical terminology. So, briefly, we are talking about one of the diseases, one of the syndromes, and the description of that in very brief description. So, Klumbek's palsy or claw hand. This is a brachial plexus injury, as we know. So it is a traction or tear of C8, T1 nerve roots on infant's arm during delivery, okay, and or on trying to grab a branch in adults, like someone is falling from a tree or something and try to, grab a branch of a tree, and there is a excessive separation which is happening between the trunk and the arm, so excessive stretch on the axilla, okay, causing injury to C8T1. Winged scapula, injury to the long thoracic nerve, C5 to C7 nerve roots, seen after mastectomy, during the removal of lymph nodes. If there is breast cancer and there is mastectomy, there might be an injury to the long thoracic nerve, also in stab wounds. Common peroneal nerve injury, lower extremity, trauma to the lateral leg, or a fibular neck fracture will lead to foot drop with a steppage gait. Steppage gait is a characteristic gait due to the foot drop. The subject is trying to do excessive hip and knee flexion in order to release the hand from the ground and trying to propagate forward or move forward. Superior gluteal nerve injury, iatrogenic injury. During iatrogenic injury means it is not intended to have this. It's just a mistake. During intramuscular injection in gluteal region, lead to Trendelenburg sign, which is dropping of the pelvis, lesion contralateral to the side of hip that drops due to abductor weakness. Like if you see the dropping on the left side, this is due to right gluteus medius weakness. Or if you see the drop happening, on the left side, this is due to right side due to left gluteus medius weakness. Pudendal nerve injury during horseback riding or prolonged cycling. It is one of the complications of prolonged cycling. Can be blocked during delivery at the ischial spine, lead to decreased sensation. They mean pudendal nerve blocking. They do during delivery, lead to decreased sensation in perineal and genital area, okay, associated with or without fecal or urinary incontinence if there is pudendal nerve injury. Radial head subluxation, nursemaid's elbow, due to sudden pull on the arm in children, lead to radial head slips out of immature annular ligament. Okay, so this is a description of the nursemaid elbow. Slipped capital femoral epiphysis, obese young adolescent. This is the most common population we see this with hip and knee pain, increased axial force on femoral head, epiphysis displaces relative to the femoral neck. This is a description. Achondroplasia is a constitutive activation of FGFR3, lead to reduced chondrocyte proliferation. I can check and see what is FGFR3. Maybe I have a list of abbreviations. So FGFR is fibroblast growth factor receptor. Okay, this one lead to reduced chondrocyte proliferation, failure of endochondral ossification, lead to short limbs. Osteoporosis, reduced bone density, due to increased osteoclast activity, reduce bone mass, secondary to reduced estrogen level. That's what it is more common in female after menopause. Old age and long-term use of medications like steroids, side effect of long-term use of steroids. Osteopetrosis, is a carbonic anhydrase 2 mutation, lead to reduced ability of osteoclasts to generate acidic environment, lead to reduced bone resorption, dense bones prone to fracture. So it is dense bone, but still weak, prone to fracture. Pancytopenia, decrease marrow space. Osteitis deformans, bagged disease of bone, increased osteoclast activity. This is the first stage, followed by increased osteoblast activity, formation of poor quality fractured bone. Osteoarthritis is mechanical degeneration of articular cartilage, inflammation with inadequate repair, osteophyte formation. These are the characteristics of osteoarthritis. Rheumatoid arthritis is an autoimmune inflammation, lead to bullous formation. Bullous formation is something which is formed inside the joint, is abnormal formation of tissue, which will lead to the deformity or deformation which we see in these joints, especially for the hand and wrist. Erosions of articular cartilage and bone. Sjogren syndrome is an autoimmune reaction, lymphocyte-mediated damage of exocrine glands. Systemic lupus erythematosus, predominantly type 3 hypersensitivity reaction, some abnormality of the immune system with reduced clearance of immune complexes. Immune complexes means antigen-antibody complex, which will be formed and deposited in tissues. Lead to hematologic manifestations are a type 2 hypersensitivity reaction. Okay, so some of the manifestations related to type 3 hypersensitivity reaction, and as a hematologic manifestation of systemic lupus erythematosus is type 2 hypersensitivity reaction, which is antibody mediated. Blindness in giant cell or temporal arthritis, ophthalmic artery occlusion. That's why it might lead to blindness because of ophthalmic artery occlusion. Myasthenia gravis, autoantibodies to postsynaptic nicotinic acetylcholine receptors. Okay. Lumbar 8 on myasthenic syndrome, autoantibodies to presynaptic. So myasthenia is postsynaptic. Okay. Lumbar 8 on presynaptic. Calcium channels lead to acetylcholine, reduced acetylcholine release. Albinism, normal melanocyte number. This is important. So the melanocyte, which is giving the color or pigmentation of skin, normal number, but reduced melanin production. Okay. Vitiligo, autoimmune destruction of melanocytes. Okay. Atopic dermatitis, epidermal barrier dysfunction, genetic factors, loss of function mutation in the filaggrin FLG gene, immune dysregulation, altered skin microbiome, environmental triggers of inflammation. Allergic contact dermatitis, type 4 hypersensitivity reaction. So atopic dermatitis is different from allergic, so atopic dermatitis is some genetic thing, immune dysregulation. Type 4 hypersensitivity reaction is allergic contact dermatitis during sensitization phase. Allergen activates T helper 1 cells, lead to memory CD4 positive and CD8 positive cell formation. Upon re-exposure again, CD4 positive cells release cytokines and CD8 positive cells kill targeted cells. Thank you and see you in episode number 8. So